Fellow with Green and Healthy Homes Initiative. And further down is Ms. Rachel Locke. She is the ASPPH Public Health Philanthropy Fellow with the Beaumont Foundation.
Yeah, long title.
Yeah. And next to her is Ms. Madison Detson. She's the Public Health Studies Senior at Johns Hopkins University. And last but definitely not least, Ms. Arshdeep Kaur. And she is a student at Johns Hopkins Bloomberg School of Public Health. Everyone give it up. So we have some questions, but we also want to make this a free-flowing conversation. So I might throw some things at you, so hang tight. But let's start just with you telling us about yourself and your work in this area. And we'll start with Jamal.
First of all, I want to thank NSA and the Children's Environmental Health Network for putting on this great event and for inviting me to come and speak to you all. I want to thank the previous panel for setting the bar so high. And then I want to thank all of you for coming and caring about what we have to say as young people. So, again, my name is Jamal Lewis. I'm originally from Landover, Maryland, so I'm a local product. And I did not anticipate going into the field of environmental health. I grew up spending a lot of my time playing sports, playing basketball, and I had aspirations to go and play professionally. I played basketball in college, and originally my major was communication. But I did have a passion in environmental science, but I chose not to pursue that path for various reasons. But then midway through my college career, I got sick. Got really sick to the point where I was in the hospital, in the ICU, in a medically induced coma for 6 days. And waking up from that, you can imagine that my whole perspective changed. And I decided to pursue something that I really was passionate about. So I switched my major to environmental science. And the first class that I took was a community-based lead poisoning prevention course, where we went out and taught, taught environmental health and about lead poisoning prevention to local schools, to children from local schools. That was a really powerful experience for me, and that's when I knew that this is something that I was really passionate about and something that I would want to go into. So then I made the decision to attend grad school, and you hear about Rachel, who's to my left. We did our master's together at Columbia School of Public Health in the Environmental Sciences Department, and I've just grown to love this field and realize the impact that it can have on all of us, and I want to help make a difference in that space. So thank you all.
Hi everyone, so again, my name is Rachel Locke. And yes, thanks to our previous panel, you guys were talking about starting businesses and all your volunteer activities, and I'm just watching Netflix in my free time, so you definitely give me something to look up to. In my sort of path to public health, similar to Jamal, I did not know that I was going to sort of end up in this field. I had always been interested in environmental sciences and policy, so that's what I studied in my undergraduate degree. And then after undergrad, I was lucky enough to actually be hired by the Children's Environmental Health Network. So I know many of you from my days there. I worked there for a few years. I shared an office with Christy, so she had to be in a pretty small space with me for a couple of years, but we're still close, so that's good. And it was as I was sort of making this transition to figure out what public health really is and what children's environmental health is that I realized that it had everything that I was interested in and wanted to do. It was policy, working on the environment, and for me the coolest thing was health, because as I was telling everyone earlier, I'm not a medically inclined person. Blood, gore, all that stuff in movies, not for me. Was never going to be a doctor. When they take my blood at the doctor's office, I look to the other wall and they kind of wonder if I'm going to be okay. So the fact that I was working on improving population health was the coolest thing to me, because I did not have to be in a hospital or anywhere around sort of stuff that makes me feel really queasy. So then that's when I also decided I wanted to kind of further my public health career. and I went on to get my MPH. Like Jamal, we did the same program at Columbia in their environmental health sciences department, and that was a great experience there as well. I got to work with their children's center a little bit during my time there. I'm sure many of you are familiar with their great work. And being at Columbia, you get to do things like Jamal and I both took molecular epidemiology with Dr. Pereira, so very cool to take a class from someone who kind of pioneered the field herself, so things like that were really awesome. And then so we finished up in May with that degree, and now I find myself doing a fellowship that's run through the Association of Schools and Programs of Public Health, which is ASPPH. And they have a really great set of fellowships where they have internships too, but they place recent graduates at a couple different agencies. They have CDC, EPA, and I think the NHTSA agency, National Highway Transportation. That one I always mess up the acronym. And then the one that I'm doing is actually focused in health philanthropy. So I'm at the Beaumont Foundation, which has been a really awesome and great experience. And for those of you who may not be familiar with Beaumont's work, we're focused in public health grant making, working on bold solutions for healthier communities. So we support practical tools, multi-sector partnerships, and local policies so that every person in every community can reach their optimal health. And I've had such an awesome time working there, and it's really great to kind of be able to tie all of my children's environmental health experience to the larger public health grant making world.
Hi, I'm Madison Denson. As was mentioned, I'm a senior right now, almost finished at Johns Hopkins studying public health. And Arshdeep and I have very parallel paths. We always joke that we're kind of a package deal, and so you get both of us today. And I'm going to share a little bit of our story and how we got started, and she'll focus more on the work that we're actually doing. But I am a transplant from the West Coast, as is Arshdeep. Again, very similar. And I think we were both history majors at one point. I also was a neuroscience major for about a year, and all of a sudden I realized that that kind of research, as important as it is, I just didn't have the patience to focus on something so small, and I wanted an opportunity to do research and be engaged with the community and with large groups of people and things that are making differences now, and that field is public health. And when I took Dr. Megan Latshaw's class, who has been our total champion and mentor throughout this whole process, she and the other people who taught in that class really showed me how, in my opinion, the environment is almost the epitome of public health. If we're looking at these large systematic issues that are affecting a lot of people, like what is bigger than the environment? And so I was really drawn to it, just felt like it really got at the heart of a lot of health disparities, inequalities, and systematic problems. And so, based on that class, based on the inspiring people that we heard from, we saw that a lot of these lecturers had been doing public health research and initiatives in their undergraduate careers. And we kind of looked at each other, and it dawned on us that we had knowledge, and there's not really a reason to wait, that we had the opportunity to go and get involved in the community. And so we stumbled on this wonderful thing that the Urban Health Institute, which is part of Hopkins, has called Community-Driven Research Day. Expecting to go there, we were among mostly professors and doctoral students. We were the only undergraduates. We felt a little out of the water, and we found a health partner, a small nonprofit run by Sean Gordon. And instead of being able to do the grunt work that we thought we were going there to offer to these different community organizations, we were able to partner with him, and we applied for a grant through the Urban Health Institute. And we're surprised and really, really excited when we were fully funded. And so Archie will talk a little bit more about herself and that project that we're working on.
Thank you. So hi, I'm Arshdeep. I, as Madison mentioned, was also an undergrad public health major at Hopkins. I was also a history major before that, and I think I was like writing about like social inequalities and like historical racism and all these things. And I was like, wait, there are like real applications to these things now. And I was really passionate about health, and Madison and I were both interested in going into the medical field. So that's kind of how I got into public health. And yeah, we are West Coast transplants and getting used to the humidity in Maryland. So yeah, so our project really is, like Madison said, funded by the Urban Health Institute, and so we partnered with Cool Green Schools, which is the name of this small nonprofit that Mr. Gordon runs, and so we work with him and with teachers and students at 2 local Baltimore City public high schools, And so what we do is we teach students the basics of what environmental health is, what the scientific method is, how to do research, and then students pick the topics that they're excited about because they're obviously very aware of the disparities that exist and of the environmental health issues that are around them and in their schools. So they choose topics that they're passionate about, and we provide them with mentorship and funding so that they can develop their own research and their own interventions. So our goal is really just to provide students with kind of an inroad into the world of science and research and environmental health. And before and after they participate in our program, we survey them just to see if the programs had an effect on their interest in STEM, in their feelings of being supported, of empowerment, and we've seen some really encouraging results so far. And we're really excited to keep doing this project this semester and next semester. Thank you.
Awesome. Now, just in terms of our next question, I'll start with Arshdeep, if you could. What do you think are just some of our biggest environmental health threats to children, and what you could do in your career to help address those?
So I think through the work that Madison and I have been doing, the built environment definitely has been kind of the major factor that we've been learning about and been interested in. And obviously, like, there are things in schools that are really relevant to that. Like Baltimore City Public Schools were in the news this January, you know, for having like freezing temperatures and students in classrooms with no heating, and that's an important issue. But the larger built environment is also obviously has a big effect on children's health. And so things like living near fracking sites or in a neighborhood where you don't have a safe route to walk to school, obviously all of that also makes a big difference. So I think that the built environment is definitely kind of the major issue that we're dealing with. And I don't claim to have all the solutions for sure, but I think that community-based work is a really important part of that.
It's such a loaded question, right? But again, you know, I'm about these simple kind of macro level things, and I think that air quality is often cited as one of those main factors that can really harm children's health. As I was looking up statistics, I was kind of floored when I realized that the World Health Organization had recently reported that 92% of the global population is living in a place where the ambient air quality does not meet their standards, which is crazy to me. Like we said, we're talking about how water is a basic right, and like we might be paying for air next. Like, that's a real thing. If 92% of the people, 9 out of 10, aren't able to have air quality that meets those standards. And that leads to a ton of disease burden in children, specifically respiratory infections, things like asthma, even related to pneumonia. And I have had a lot of personal experiences that have made this really poignant to me. I grew up in Salt Lake. It's definitely a valley, and it was not uncommon to have our gorgeous mountains be obstructed by inversions for a large portion of the winter. And it's not quite as fun to go home anymore as the plane descends through this cloud of smog. And it's not difficult to guess that that is probably not great to be breathing and is going to have negative health consequences. And so being in college and studying more about it and recognizing that it's also a problem in my current hometown of Baltimore has really pushed me to think about air quality at the forefront of environmental health. In Baltimore, for example, the asthma rate is actually twice the national average. And statistics like that, and statistics that are pointing to the fact that minority, especially Black children, have much higher rates of childhood asthma, I think that for us as public health practitioners and as concerned citizens, points to that's something that we need to focus on. If our environment is shared and certain percentages, certain groups in the population are being affected more by it and are suffering those consequences, that means that that's a call to action and needs our attention.
So yes, I agree, definitely a loaded question. I'm actually gonna, I think, speak to what I think of as competition and by extension communication. You all read the news, we live somewhere in DC. There's a lot of huge problems that we're faced with every day, whether it's structural racism, sexism, climate change, millennials are ruining marriage and buying too many avocados, all of the stuff that you see come across your newsfeed. I feel like a lot of the time in public health, and especially in children's environmental health, to me, it feels really hard to get your voice heard. And me, not myself, but a lot of you in this group have been working at this for a lot longer than I have. And so I think it's a really big challenge to have effective communication tools and make our case to the people that we want to about why our issues are important and why investing in kids' health really can trigger a whole positive set of outcomes for their lives, for our communities. And I think this problem I found recently is interestingly compounded because of the nuanced definition to us, but not to everyone else a lot of the time, between health and healthcare. Healthcare obviously has been really dragged into a super partisan space, and not that it's not a huge part of health and makes a really big difference, but it is very different than health as an overall concept. And there's some interesting polling data that a couple people that I've heard from present on, that health, when you ask people about it, has a much less partisan tone than healthcare, not surprisingly. So again, I think it's difficult and a challenge for us to reframe the discussion to health, then also to public health, which is even hard for me to describe a lot of the times, and then also to children's environmental health, and why we really need to be investing in this and building coalitions around policies for health. And I will take full blame on part of the problem that I think the public health field is kind of coming to reckoning with now, is that we really love data. Data is our best friend, and it is for me, it's our best thing. We use it to diagnose our problems, we use it to figure out if our interventions are working, we use it then to figure out if, is this our best practice going forward? So we are data heavy a lot of the time, both in our internal circles and our external circles. And I'm not saying that that is a bad thing or that we need to ignore data at all, but I've been in a lot of conference presentations lately where they talk about data backfire effect. I don't know if any of you have heard this, or there are probably communications experts in this room that know much more than I do. But a couple examples that I'm borrowing from another talk that I heard are that if you're confronting someone with a different opinion than yours and you try and come at them with a lot of facts and data, which would be my go-to, that will entrench them actually in their views. So I was like, okay, interesting. And then I know a while back, or maybe the more current, but the kind of communications format of using a myth versus fact sheet. I know the CDC had one for flu shots. When I first saw that, I thought, this is great. People think one thing, it's a myth, let's tell them the fact. Then they will say, amazing, flu shots are great, I'm gonna go get mine. Not in fact the case, I learned. It actually, again, entrenches people thinking more about the myth than the fact. So kind of just, that for me, that really upended how I think about what I'm gonna say about public health and how I try to communicate it to people that may not really be in the field. And then the other example that I thought was also interesting is, if we say all the time that, a third of our children are obese or overweight, and we really need to be tackling this as a public health problem, that also gives license to other media outlets or different partners to say, well, 70% of children, or my child, is doing just fine, so we don't actually need to focus on that problem. So I've really seen the challenges that we face in the communication sphere in getting the messages we want out there, and I think there's a lot of really great tools and solutions that are coming up to help this, but that we are kind of facing this new paradigm shift in how we try and talk about our work and how we actually make it have the impact that we know it can have.
I'm gonna say that the number one, one of the biggest environmental health threats that we see affecting our children is their housing. Housing is a place that we all hopefully go for refuge from all of the harmful things that we see and that we experience in our lives outside of our home. But there are so many families and children that are going home seeking refuge, but end up in a place that's just as bad for them as going outside. And so we heard earlier about the number of kids that are being affected by lead, whether it's through paint, whether it's through the water, soil in their communities. We heard earlier about the number of kids that have asthma, and that number is increasing every day, and they're living in homes that are constantly triggering this asthma. A recent poll found that over a third of households, and I'm falling into the data thing that Rachel just said.
It's okay, you're in a safe space.
Over a third of households are unable to meet their basic household energy needs, and so what we what you think about when you hear that is heating and cooling. Think about it. A third of people are, a third of households are in the summer unable to cool their home, and in the winter unable to properly heat their home. And when you think about the impact of all of those things, in addition to the harmful chemicals that are often found in our furniture, in our cleaning products, that are all in our homes, you think about the impact that can have on children. It's astronomical. I mean, it's crazy that we're allowing our children to live in these environments that can negatively impact our health. And I'm just gonna quickly tell a story. Cynthia, I don't know if she's still here, but I sat down at a table this morning. And Cynthia's originally from Oregon, but has now lived in Virginia longer than she lived in Oregon. But still, it's like the place where she grew up, still has a special place in her heart, and that's just the impact that we know that our environment has on us. But what about the unknown impact that our environment is having and that our housing is having? We think about the rising cost of living and the rising cost of housing that is leaving households and families unable to pay their rent, unable to pay their energy bills, and are being forced out of communities that themselves, their parents, their grandparents have all grown up in. So we're really uprooting these communities of people that not only seek refuge in that home, but seek refuge in their community. And that is a huge threat. When we talk about adverse childhood experiences, that's something that can stay with a child for the remainder of their lives. And so to me, that's the biggest, one of the biggest environmental health threats that we face, that the children face today.
So I wanted to kind of dig deeper into something that Rachel shared about just the adverse reaction to facts and data and science that we've been seeing as the national trend for people not really wanting to hear actual evidence and proof of the work that we do. How do you guys think we counter that? Like, what is the messaging? How do we communicate something to connect with people to start moving them more to care about these issues?
I brought up the problem, so I should probably have the first response. So one thing that I've heard talked about is kind of reframing to have an inclusive narrative. So not that everyone is selfish, but a lot of the time the question is, what's in it for me? What's in it for my family? What's in it for my community? So it's about thinking about how we use the facts and data that we know are really important, but to build something that encompasses everyone and brings them in. And then unfortunately for us, and I find this super hard, but to get away a bit from our lovely jargon that we like to use, like in the Beaumont's work, they focus a lot on upstream social determinants of health. That's not a foreign phrase to most of you in this room, but it's a foreign phrase to a lot of other people, and for good reason, because it's kind of an esoteric phrase. I think it's really about kind of grounding in your narrative what you're trying to get at, the larger encompassing goal for everyone, and then showcasing hopefully the successes and best practices that we know kind of work. And then also on the flip side of that, on the data and science question, I was actually giving a presentation for the network about our Eco Healthy Childcare program a while back, and someone in the audience had a question. She asked me, "Is plastic safe?" And I kind of had to stop and think about how to answer that, because to me that was a real communications challenge, because okay, if you're using a plastic but you're not heating it up, is it safe? If you're using it and you are heating it up, how much BPA gets released? If you buy one without BPA, is there BPS? My mind is spiraling into all these different things. So it's really hard, since we're so grounded in science and facts all the time, to come up with really good, concrete answers for people, other than, I don't know, maybe if you can buy glass, great, but also don't break glass in your child care center, because that's obviously very dangerous for children. So I would not say that that was a communication success for me in that moment, because I did not have a really good answer that, understood where this woman was coming from and where I was coming from, and then gave her an actual step to kind of move forward on this. So in short, I don't totally know, but I do believe that kind of by building a wraparound narrative to a lot of the problems we're talking about and tailoring it to the audiences that we're with, that we can have some success.
Anyone else?
Yeah, I would say I think Arshdeep and I are biased because this is the way we do our work. but I feel like engaging the community in a true partnership is really key to helping people buy into this kind of research and data idea. I know that for us in our work, it's very different. If we were to come into schools and say to children, okay, these are the things you should be concerned about. These are some statistics about like how this is harming you. One, it's kind of a negative narrative. And two, we're imposing our views from our like little offices and library nooks on these people who are living it every day and who already have a lot of ideas, solutions, and insights into what is going on and like what are these root causes that are most affecting them day to day and that they think would be easiest to solve. And they're also people who already have partnerships established to really do the work. And so I know for us, engaging kids and having them be the ones who are getting the data that they can then present to their school principals. That was really empowering for them and for us. Just, it was amazing to see how invested they were in the work and just having the community be able to buy into things that we're telling them about themselves. Instead of having this kind of uneven top-down approach, just being on an equal level, understanding that we both bring different things. I'm not sure, I don't have a good answer as to how to upscale that, because it's very different when you're working, trying to disseminate information to an entire population. But I know that working with small groups like this, it does create ripples. We had a science teacher who said that at the end of the semester, he was in tears or dust in his eye because he was so impressed by the work the students had done, and that has now prompted him to change his entire curriculum. He's been teaching for over 20 years. And so although we're not going to be there every day as researchers and as public health advocates, having those really interpersonal connections, that's going to affect all of his classrooms in the future. And additionally, working with the students, as our sheep said, we had a lot of metrics about before and after. Do students feel like they have the power, the tools, the resources, the people to make changes to these problems that they've identified? And almost twice as many students afterwards said, yes, they definitely feel like this is something they can do. And so I feel like just engaging in those smaller groups is a way to kind of initiate those ripples that are really going to last and have impacts in people's lives, and then they in turn will go about doing our work as well.
I totally agree, and I would add that there is definitely a big role for institutions to play, I think, because we know that like maybe the federal government isn't currently the best advocate for environmental health, or children's environmental health, which is maybe an understatement. But I do think that institutions like academic institutions and maybe local governments can play a big role in kind of changing that narrative. And so there's a ripple effect in the community, but there's also a ripple effect on the people who are doing the public health work. Like, we are starting out in this field, and our first research project is community-based, and so therefore we kind of carry that lens with us through the rest of our careers, hopefully, and that helps us shape the narrative that we're presenting to community members, to people at our academic institution, and hopefully to people who have more policy-making power.
How important, especially since 3 out of 4 of you, there's a statistic, are not from the area, don't worry about it. How important, in terms of the engagement that you all do with communities, is diversity, and also just kind of letting go of who you are to help those people? How do you do that in your work? So the one person from here.
I have to out myself. I'm also from here. I'm from Arlington, Virginia.
You want to start?
No.
Yeah. All right.
Well, you can speak to diversity.
Yeah. So it's really important that for our entire mission to have diverse thinking, diverse groups of people all coming together to work on and to advance our mission. It's important because people have different perspectives, as I'm sure you all are well aware of that. But it's particularly important to bring in the perspective of the communities that we work in. And that's why the project that you all are doing is so important. But we, a lot of times when you hear about public health work, when you hear about, the global health work that's being done, and even the work that's being done here in the United States, it's people coming in from not the community, and then trying to tell the community what is best for them. And that's really not the way to get the community buy-in. Is not the way to advance our mission together. I mean, you really need to have people who are from the community, representatives from the community, or the community at large, at the table, and to have this dialogue, to be able to say and work with them to advance our mission, but also advance the mission of the community. And while that may take longer, because talk about communication, you really have to meet people where they are, to build a shared understanding of what's happening in the community. What are the best ways to move forward. It's really the best way to come about a solution, because then you have a solution that works for everyone. And so diversity is important, but diversity, bringing in people specifically from the communities that we work in, is of the utmost importance.
Yeah, so I grew up in Northern California, in the Bay Area, middle class, moved out here for college, and Baltimore was definitely like a different environment for me, And I think the very stark disparities that I saw really had a big impact on obviously like my public health journey, and also just like my career trajectory in general. And I think that like a big part of that is like having the foresight of the planning projects and the planning interventions to make sure that we are incorporating community input. And sometimes that's like hard for us to do. Like there was one student in one of the classes we were working with who just straight up was like, how come you're at Hopkins and you have this like really nice campus and my school has, like we can't drink from our drinking fountains? And that's like something that obviously he's right. Like that's something that is a disparity, which isn't fair. And so acknowledging like coming from a place of privilege, I think is really important in this work.
I would just echo everything that's been said, and I feel like one aspect of working with people who are in the community is you prevent yourself from being able to cherry pick people who are like you or who have similar experiences. We're going into schools and we have a classroom, and the people who are already in that classroom, that's who we're working with. And I feel like taking kind of that personal bias out of it and just looking at people who are in a community who have a specific interest and just working with the people who are there, that combats a lot of like our personal kind of preferences or ideas about what discipline should be working on this or what kind of person with what kind of background.
And I'll just quickly add that I'm always astonished by everything that I don't know, and so really trying to always widen my circle and having great people around me that do specific community-based research. I'm not an expert in that, but beating the drum that this is what we need to be doing, and we can't be doing things to communities. That's wrong for so many reasons. I think it's just super important.
Awesome, good answers, guys. And it was mentioned, things federally have stymied in terms of how environmental health and environmental protections are being looked at, where it's almost a well, we know it's for sure, it's something negative in that perspective. How important are counties and local municipalities and states to your work? How important are those relationships?
Yeah, so I think that I don't have much experience personally working with policymakers at the city level or the state level, but I do think that having multidisciplinary work can be really important to making inroads with those local governments and with those policymakers. Because like I was talking about the built environment earlier, and like obviously that's something that we in public health and environmental health care about a lot, and we think about like the exposures to children. But there are people in other areas of public health and in social policy and urban planning who are also thinking about the built environment. And I think like kind of pooling those resources and that knowledge and data and communicating it well is important, because there are people working on, obesity prevention in the built environment or climate change adaptation in the built environment. So I think that taking a multidisciplinary approach is going to be really essential.
I feel like we've talked about a lot today about really narrowing in on specific groups of people, on communities, and I feel like the next step, is that level up of communities to city governments, local governments, and states. And so I feel like that's a really natural progression. I think in our work, we kind of have this moral debate about, how much pressure should we be putting on these smaller groups of people to make these changes when it's really like the governments that should be providing this out of necessity. But the fact of the matter is, like, this is the world we're in, and there's so much power and knowledge in these communities to have those effects at those state and local levels that do have ripples onto that national scale.
So I am new to the Duwamish Foundation's work, so still very much in learning mode. I've been there for 4 or 5 months, but they are really focused on a lot of city and local policy, and especially having the local public health departments and the commissioners be the leaders and advocates and chief health strategists for their entire community. So I've been on this great sort of whirlwind tour of learning about all of these local successes that have been happening. Just 2 quick examples. I don't know if any of you are familiar with the program City Health, which is an initiative of the Duwamish Foundation and now Kaiser Permanente. And it's for right now the 40 largest cities, and there's a policy package of 9 different policies that we promote, each which addresses an upstream social determinant of health. And so we bring these policy packages with our partners to different local partners on the ground in cities and city councils or county commissions, and say, which of these policies are you working on? Could you implement? It's everything from restaurant grading to smoke-free indoor air to less alcohol densities on the streets to reduce violence. So it's really a wide range of things. And it's really great to see the excitement that these cities get around having support and advocacy for putting these policies into their place. And then the other cool thing for us is we're able to give medals to cities based on how many of these policies they do and how many they do overall. So there's bronze, silver, and gold, obviously, for the medals. And these cities get really competitive and excited about being able to get a gold medal in one of their policies they've been working on, or even a gold medal overall as your city, because it does send a really interesting communications message to your citizens. Also, like me as a mayor, me as a health commissioner, we are prioritizing your health and our residents' health for our city, and we're working towards that. So it's a relatively new initiative. I think it's been around less than 5 years, but it's having a lot of really awesome successes. And then the other example that I've been learning about is a collaboratively funded project where Duwamish is the fiscal sponsor. It's called the Build Health Challenge, and it's in its 2nd round now, and it basically challenges communities to come together and think about an upstream health problem they want to work on. So we're issue agnostic. You can work on obesity, you can work on housing, whatever you really feel your community is facing. But the important thing is that you have to build a multidisciplinary team to do it, and it has to have someone from the local health department. It's led by a CBO, and then also a hospital or health payer system has to be in it as well. So again, this is a really locally grounded and based thing where communities can come together and pick their issue and then really get some funding and some technical assistance to try and move it forward. And I just went to the convening of the Build Health Challenge. It was a couple weeks ago, and it was just awesome to see everyone there doing peer learning and talking to each other and saying how great this sort of the ripple effect has been of being able to start these partnerships, having it change how they work within their own systems, and then obviously it's kind of hard to tackle obesity in 2 years in your community, but there's other process measures along the way that they've been able to really glean some great outcomes from.
So the federal government is very important, providing the means and standards and in some cases protocols that guide our work. But for environmental health, a lot of times the solutions are really locally, at the city level, at the state level. The solutions are really there at the local level in terms of unique policies that may be in place, or even stricter standards or even stricter protocols. But really, the capacity building that is necessary to accomplish a lot of the work that we're trying to do is really the opportunity for cities and counties to engage in. So building the workforce that we're talking about in order to accomplish a lot of these environmental health goals that that we want to reach. It's local. The solutions are really at the local level. So, and in my work, in my role at the Green Health and Healthy Homes Initiative, we have a number of projects where we're working with cities to help improve their housing standards and housing protocols, and to help create different funding streams and help to build that workforce that will ultimately help improve quality of housing. And one of the projects that I'm on, I get the opportunity to talk with local health departments in the state of New Jersey, where they really they have some resource challenges, but the solutions really are in their wheelhouse, and my job is to really help them realize that they do have enough there to accomplish these goals. So the local level and city and state levels are really important.
Awesome. So we have less than 5 minutes, so I have one question, and it's going to bring us back to the title. You guys are emerging leaders. People have a lot of faith in you right now to go out and solve a whole bunch of problems. But when we think about the future, say 5-10 years, what problem will you be addressing? Would you have accomplished it? Where will you be based? What will you be doing? So think about your future and just give us a short summary of what you think you'll be doing then.
So as I mentioned earlier, I'm interested in going to medical school and working as kind of a joint clinical practitioner and also public health practitioner. Ideally, I'd love to be involved with city government on some level with a health department and kind of be involved in that programming and that policy aspect. What specific area I'll be working on, I can't say, but I'm excited to see where I end up.
I, like Arshdeep, no surprise, similar goals. I'm hoping to go to medical school in the next few years and to really integrate that into my practice integrate public health into my practice as a medical doctor. I'm hoping to focus on pediatrics and especially these urban issues. I'm really trying to push for that more public health and preventative focus into clinics and into medical care.
So yes, I don't have a super specific answer, unfortunately, but I hope and still plan to in 10 years being a champion for children's environmental health, for public health. I would love to kind of, pulling in the sports theme from our previous panel, make public health that cool on TV sport to watch that everyone actually really cares about, is really invested in, and if your team is your community, you want them to win and be the healthiest they can be. Again, I also would really, I think, love to continue to work in grant making and policy making, especially at the local level. I think we'll see continued successes there, but always sort of, beating the drum that if we start with kids first, we're gonna have really big wins.
So I would really love to see other people of color in this space. I see a few of us here, but as someone who grew up in this area in a predominantly Black neighborhood, environmental health was not something that we thought about. Really, the standard for living was, not having a home that was properly heated, a home that didn't have any holes in it, a home that we could really be proud of. And so I would really hope to, in my work, to go and engage. So yes, we are the emerging leaders, but the folks that are really important in our fight are the ones who are growing up right now, and the ones who are in school right now. And so I hope to be able to foster that interest in environmental health to the point where their standards are raised, to the point where they can be happy and be proud of the water that they drink, the areas that they live in, and the air that they breathe. And so that's what I hope to do.
Awesome. Give it up for our panel guys.
Thank you all so much. Wow, you guys are amazing. Thank you. We've learned so much. And again, same invitation.